Washington, D.C. is my home away from home. I've worked here for the better part of 3 decades as a founder entrepreneur, policy expert, and author.
Probably the longest title. Everybody sort of shortened it to ONC for sanity's sake.
Mercifully.
Yeah, mercifully.
I've learned leadership secrets from many healthcare executives who understand that Washington is the largest payer and regulator of healthcare.
She said, well, because you'll never get a husband if you do that.
I began interviewing healthcare leaders many years ago because what better way to learn how they think, why they make it to the top, and how they remained there. Think about what was your most challenging engagement.
Healthcare has been the most difficult problem, I think. Let me just say that.
We'll talk about that later. Ruth Williams-Brinkley was raised primarily by her grandmother on a small farm in Georgia where she was instilled with the values of hard work and resiliency. She began her leadership journey as a nurse, serving as a nurse manager, chief nurse, and moving on to become a CEO in health systems. Building on her leadership experience, she was invited to join Kaiser Permanente, and she has become the regional president for the MidAtlantic states. We explored Kaiser Permanente's unique care model with Ruth, and how person-centered care and affordability is at its core. Ruth realized when she arrived at Kaiser Permanente that it focuses more on preventive measures and providing care throughout the continuum than non-capitated models. Ruth described the partnership with Unite Us to build the MidAtlantic Community Network data infrastructure. Its purpose is to merge social and healthcare data to address social determinants of health across the socioeconomic spectrum. Mentorship has been an important part of Ruth's career. Early on, she was advised to network and befriend search consultants who were aware of professional opportunities. Now, she returns the favor and mentors young professionals or links them with the right sponsor. In advice to up-and-coming leaders, Ruth recommended setting career goals, but always being open to new opportunities. Well, good morning, Ruth, and welcome.
Good morning, Gary. Thank you for having me. It's good to see you.
We're pleased to have you at the microphone. This show is about leadership, and Ruth, you've had a marvelous leadership career to this point, and with more to come, I'm sure. Our point of view is that understanding the background of our guests gives us a view into their leadership style. So why don't we go back and start at the beginning. What was life like growing up for you, Ruth?
I was raised, grew up on a small family farm in Georgia, which is still in our family, has been in our family for over 100 years. And I was raised by my grandparents, my grandmother mainly. My parents were young parents, and so my grandparents raised me. My grandfather died when I was 4, so it was really my grandmother and one aunt who was still young enough to be at home, and it was the 3 of us, and that's how I was raised in a very rural area. There, like for instance, like the population is about 400 people, and that's probably more than on any given day.
Do you think your leadership style came a bit from your grandmother?
Absolutely. My leadership style absolutely came from my grandmother. As farmers, and I don't know how much you know about farmers, but there's always things to do. After my grandfather died, my grandmother ran the farm herself, along with us and some hired people who helped us. And every season, you were either planting or you were cultivating or you were gathering or you were preparing for the next planting season. And so we worked a lot and we were very self reliant, as most farmers are to a large degree. And my grandmother had been a teacher, so she was very strong and made sure that we did what we were supposed to do in terms of work, in terms of leadership, in terms of education. And so I picked that up from her. And she was really resilient, never really verbalized any type of defeat, although I know she must have experienced defeat on several levels. but I got that from her. Yes.
What was the young Ruth like, and what would she think, looking back on it, what would she think about leadership?
I don't know at a young age if I had a real strong sense of leadership. What I knew was that I was motivated to study. I was always a good student, and I loved school. And I guess that's a form of leadership. And I actually, and now that my memory is coming back, I actually held class leadership positions as class president, um, as in the honor society, as a leader in the honor society. And we didn't have any kind of robust sports program at our school, at my elementary school. However, as I went to high school and I joined high school clubs, I didn't join a whole lot because I was pretty studious, and having an opportunity to lead in those clubs was important.
Do you remember thinking, gosh, I really enjoy leadership and I think I'm going to pursue that as I grow up? Would that thought ever kind of pass through your mind?
As I think about that, I did enjoy leadership. And however, I didn't think beyond the moment in time in terms of high school or junior high school or even elementary school. I didn't, most of the people I was around were farmers. And so you didn't really see organized leadership except for the leadership of individual family farms or things like that. And so I didn't, as I think about it, Gary, I really didn't see that as leadership at the time. But now, again, as I look back on it, there was tremendous leadership. These were small, medium-sized, and large businesses because running a farm is a tremendous responsibility. You've got animals, you've got crops, and so forth, and everything has to run on a schedule. When the crops are ready, they have to be harvested, and that's how you live. So I look back on it today as leadership, but I did enjoy it. I did enjoy having the opportunity to lead in school and to lead, whatever we I was able to lead in my house.
Well, how did your decision to enter nursing come to be?
Well, my grandmother had always wanted me to be a nurse. She was a teacher, and there are a lot of teachers in our family today. I think I'm the only, there's one other person. I have a daughter-in-law who is a registered nurse. However, my grandmother had decided that I should be a nurse. And being a bit of a rebellious child, I decided I didn't know what I wanted to be, but I knew I didn't want to be what someone told me I should be. So I went away to college, not quite knowing what I wanted to be, and ended up going into nursing, as my grandmother had always led me towards going. And I look back on it today, and it's just amazing how I ended up exactly where she wanted me to be. And it's been a great career. It has been incredibly rewarding because I really love helping people. And that's what really motivates me and what drives me.
So I'll be willing to bet that you gravitated into nursing leadership fairly early in your career. Is that true?
I did. And again, I don't recommend this, but I didn't know even after I graduated. I about 3 or 4 years when I got my first management job as a nurse manager, I realized then I really loved leadership. And then I set a goal that I wanted to be a chief nurse, and I reached that goal. And it was, again, very fulfilling, very rewarding, to help nurses see what could be done and how we as nurses could impact patients' hospitalization and their life, quite frankly, because when someone is in the hospital, it's important to take good care of them, make sure they don't get infected, just make sure they don't get any kind of unnecessary complications, and that is something that I enjoyed tremendously, and as well as helping the nurses find their professional voice and their professional contribution. So I enjoyed that tremendously.
Just thinking about nursing leadership, and we'll talk a little bit later about leading the whole enterprise, but thinking about nursing leadership, any tips that you learned about how to lead nurses?
Well, the things I learned about nurses are things that I would apply to others as well. First of all, everything we do in healthcare is through people. We have buildings, we have equipment, we have all kinds of things, devices and technology. However, at the end of the day, it is people that deliver the care and people who care for you when you're ill. I never heard anyone ask for a machine when they were critically ill. They asked for a person to take care of them. And so I feel like taking care of your people, the people who are around you, is incredibly important. And giving those people an opportunity to have a voice, to exert their professional uh, 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 thoughts and expertise, it's really important. And for nurses, I just have so much respect for nurses because they are there at the patient's bedside in the hospital setting all the time, and they do so much. So nurses are my personal heroes, and I love working with them.
Well, you moved from nursing leadership to enterprise leadership, which isn't surprising given your background in leadership and your interest in it. But what was the story that moved you from nursing leadership to leadership of the whole institution?
It was interesting, Gary. I had been a chief nurse 3 times, and I was in my dream job at a major academic medical center. And I was really happy and loved it there, loved my life there in that particular city. And then my husband wasn't able to. My husband was working at the time, and so I one of us had to move because we were in different cities. We were commuting, and so I moved back to the city where I had left to take this job that I loved. And so when moved back, I was wondering what I was going to do. And I was recruited by a consulting firm. And I took the job as a consultant doing operational turnarounds. We didn't call them that at the time, but that's what they were. And it was it was just a tremendous experience. I did worked in the U.S. in some of the largest academic medical centers. I worked in Canada in 2 of the largest academic medical centers, and and it was just tremendous in terms of expanding my capacity, expanding my thinking, expanding my strategic thinking, especially. So that sort of gave me a different view on life, and it helped me to be viewed differently as a professional. And so after I'd been in consulting about 3 or 4 years, um, I started getting interest in me from recruiters to look at CEO jobs. I did not take a CEO job during that process. I interviewed for a couple, but they weren't the right fit for me. And so I was subsequently recruited to a large Catholic health system for an operations role that wasn't a CEO, it was a vice president role, regional vice president role. And within a few months of being there, there was a need for a turnaround at the whole national system. And I had this turnaround experience from my previous job as a consultant. And I was tapped to do the turnaround for this system. I have to tell you, it wasn't something I looked forward to doing because, as you probably know, consulting is a hard job. You're traveling all the time. I had a teenage daughter and I wasn't looking forward to more travel. However, I did take the role and we did the turnaround for that system in about 3 years. And so this now brings me to about 8 years as a consultant. And I was looking for my next role because I knew that it was exhausting. I needed to be closer with home with my daughter. and it was just exhausting, quite frankly. And so I was asked to take. I let it be known in the organization that I was interested in doing something else. And so I was asked to take an interim role as a CEO in one of the hospitals in that system. And I took the role. And after being there for a few months, I was asked to stay there. And that's how I got my first CEO role. It remains one of the most enjoyable and fulfilling roles that I have ever had. And it was great. It was a great little city, smaller city in the southeastern United States. Since I was from the South, I felt right at home. I'm from the Southeast. And so it really turned into a great career path for me. And I would have never guessed that I would have ended up there because I'd been a chief nurse for 3 times. I was wondering what I was going to do next. I didn't really have a clear thought. And to be real honest, Gary, at that time, nurses weren't viewed as professionals who could lead health systems or hospitals in a broader role. So I didn't have that goal for myself. And it was a surprise, a pleasant one, and it really opened up a whole new career path for me.
Well, you made reference, Ruth, to moving the family, and clearly that takes a toll on you, takes a toll on your family. Ultimately, how did you manage the various moves that you made with your family?
My son, I have 2 children. I have a son who's my eldest, and my daughter who's younger. And by the time I was doing these moves, my son was already in college, and so he was out of the house. My daughter really was the one that ended up with a lot of the upheaval. And I tried always to look at it as a sense of adventure. And I tried to instill in her that sense of adventure. But as I look back on it, Gary, it was hard for her. It did make her resilient, it made her adaptable for change. Um, but it was hard on her. And so I would say to anyone who has a family, young children or children that are in middle school and high school, it's hard. It's difficult, and you have to really try to put an ecosystem around your children if you're moving to keep some stability in their lives. And so I am really proud of my 2 children. They're both in families, have their own families. And but it's interesting, neither one of them has moved more than once. They've stayed in the same city. So, I've learned through that. I did what I needed to do during that time, and I tried to do the best I could to put that ecosystem around my children, but it was difficult.
You know, my father was a minister and we moved all the time, Ruth, so I understand exactly how all that works. And I will say that it's good for learning how to meet people. You just, you have to do that when you're moving. Well, what was behind your decision to join Kaiser Permanente?
I have been a long admirer of Kaiser Permanente for years. I I experienced being in an HMO, or a managed care plan, early in my career and never forgot the experience, and I liked it. And so I'd always admired Kaiser Permanente, and really had wondered how I could work for them at some point in my career. But Kaiser Permanente, I thought, was only on the West Coast. And I'd always worked in either the East Coast or the Midwest. That's where my family are, that's where I'm from. Although, as you know, I'm not afraid to move. I just never had the opportunity to work on the West Coast. And so after my last hospital job, a health system job, I was going to take some time off. I had worked, my husband had passed away unexpectedly during that time, and I had tried to work my way through it, and that didn't work that well, as most people know who've been through grieving and grief. And so after after we decided to sell several of the hospitals in this system, then I just made a decision that I was going to take some time off. And so I got a call from a recruiter that said Kaiser Permanente wanted to talk to me about a role. One thing led to another. And, I was quite flattered and surprised to hear from Kaiser Permanente. It's a great system. And I said I would talk to them, at least have a conversation. And through that conversation and several other conversations, I ended up coming to work for Kaiser Permanente. And I admired the system before I joined. I admired even more after I've joined.
Well, you started out in Oregon, but then moved after a few years back to the southeast. So, can you describe the Mid-Atlantic states region that you now run?
Mid-Atlantic States region serves three jurisdictions: the District of Columbia, the state of Maryland, and the state of Virginia. We Most of our work is in Southern Maryland, although we do go up to Annapolis, and then in Virginia, we are mostly in Northern Virginia, a broad circle of Northern Virginia and the district. And we have about 880,000 members across those three jurisdictions. We have about 9,000 employees and about 1,700 primary care and specialty physicians. We have 34 medical office building sites, five of which are hubs. We just did the ribbon cutting on our newest facility in Timonium, Maryland on yesterday.
Ah,
And
congratulations.
we thank you, thank you. And we have three additional hubs, and hubs are places where we have ambulatory surgery. We have what we call advanced urgent care, what some places may call observation units. And we have a lot of services gathered under one roof. So today we have five. We're going to be opening three more. And we're really excited about that. Two more, I'm sorry. We're really excited about that. And part of the need for these sites is if you've ever spent any time in Washington, D.C. metro, it's challenging to get around. It's the area. It's not a large area per se. However, it's difficult, especially in rush hour and places. And so we want to have good geo access for our members and not have them have to drive a long way. So we don't own hospitals in this region. We contract with hospital systems, with 12 hospital systems. And in those 12, what we call our core hospitals, we install our Kaiser Permanente integrated model. And that consists of our Permanente physicians and some of our nursing staff, our case managers and care coordinators, and our model. We can't be in every hospital, and sometimes, especially during the pandemic, we had a lot of our members in non-core hospitals, and but we try our best to keep them in our core hospitals. And that's how the model works. And it's a great model, and it's great to have everybody together, most of our services under one roof, and our members love it.
What are the differences between working for hospital systems, which you did before Kaiser Permanente, and now leading a unit of Kaiser Permanente? Ruth, what are kind of the main differences that it presents you as a leader?
Well, it's interesting. When I was in Oregon, we had hospitals. We have hospitals in Oregon. And I would often tell myself, okay, when I was on the hospital side of things, I would always be in a tug of war with the insurance companies for more payment or better reimbursement. And I was like, now I'm both. I guess I'm going to argue with myself. But the difference is, as we look at healthcare in the U.S., we know that we need to bring our health, all of us, Kaiser Permanente, everybody else needs to be working on an affordability goal. And so I find working on the health plan side of things that I better understand those tug of wars from both sides. Now, I always understood it, but everybody has their perspective. It's the difference is that we have a premium dollar, if you will, and we have to take care of our members. It's a prepaid system, and we promise and make a commitment to our members, and we're accountable to take care of our members' health needs within that premium dollar. And so that's the biggest difference. As a hospital, except for as a Kaiser Permanente hospital, I didn't have to be as worried about that premium dollar because I was getting my portion of the premium dollar, and I wanted to get what I needed to take care of the members that the plan would put in our hospitals. In this sense, in this region, we have those same discussions with our core hospitals, with all of our hospitals about payment and how long a member needs to be in the hospital, making sure we take care of them, making sure we get them home when they need to be home. So it's looking at all those components of what we call the entire continuum, from regular office visits to places like the place we cut the ribbon on yesterday, to if a person has to go into the hospital or into one of our urgent care centers for a 2 day stay to be observed, to that part. Then if they have to be as an inpatient, that part has to occur. Then where do they go after inpatient care? Are they well enough to go home? Do they have the family support to go home? Again, speaking of ecosystem, do we have enough ecosystem to put around our members if they go home and still need care? That's one thing we have to pay attention to. And now not now, we've always paid attention really to moving upstream, as you call it, to looking at the social components of health. Does the person live alone? Um, it's hard to send, people who are sick home by themselves. Does the person have, if they don't live alone, if they do live alone, do they have family support? Do they have food? Do they have a safe neighborhood? Do they have money enough financial resources to get the things they need to get their medications and not we provide our medications as part of the premium, but the other things that they need to thrive and do well. So we pay a lot of attention to those social components of health because we've all known this for a while, Gary, that almost 80% of what happens to a person happens outside of the walls of a hospital or physician's office. People live in their communities. They don't live in hospitals. They don't live in doctors' offices. They don't live, except for those that live in, assisted living or skilled care or wherever they are living as a home, but they live in their homes. And so we want to put the ecosystem around them to keep them healthy and to bring them in when they need more definitive care.
There's a lot of attention paid these days to a term, I'll just use the term organizing around the person. And hearing you describe Kaiser Permanente, it feels to me like that's an example of organizing around the person. Would you agree with that, Ruth?
Absolutely. And, we sometimes call that patient-centered care or person-centered care, but it really does involve organizing around the person. What does the person need to stay healthy? Now, we're all going to have to get medical care, medical intervention, maybe surgical intervention at some point in our lives. And so, how do we manage that so that people who have, especially chronic illnesses, diabetes, hypertension, those kinds of things, we want to organize in a way that helps the person manage that chronic disease, cancer, other diseases. And I suspect we'll see some chronic diseases perhaps come out of those who've had COVID. How do we help the person manage those so that they can live the optimal life and have optimal health? So that's incredibly important to us. Yes, that is organizing around the person, and I would say around the person and whoever they define as their family unit.
And then another key issue is affordability, which during COVID it was increasingly apparent that that's an issue in the country. Feels like the Kaiser Permanente model compared to where you have worked for health systems in the past, the Kaiser Permanente model is more affordable. How do you think about that, Ruth?
I do believe we're more affordable. That's something we work on, Gary, all the time. Affordability is one of our strategic goals, and we want to make sure that we're affordable so that more people can afford healthcare. Access to healthcare is really important to us, and I'm sure it's important to others as well. We at Kaiser Permanente want to make sure that our services are affordable and accessible to people who need them. So that's one of our goals. And it's a balance, because uh, people need the services, and each year things get more expensive, but we really work on trying to make that balance.
How about virtual care, thinking particularly about the pandemic and the COVID days? Did the use of virtual care pick up at Kaiser Permanente?
Absolutely. Now, we at Kaiser Permanente, we've been doing virtual care for over 15 years. And, the uptake was around maybe 20% or so prior to the pandemic. During the pandemic, our virtual care utilization went up to greater than 90%, 95% maybe. And since the pandemic, I don't want to say that it's over because we know it's not, but since it's eased a bit, we're seeing more people being willing to come and see their physicians in the offices for in person care. A lot of people were afraid to leave their homes, and for good reason. Quite frankly, in the early phases of the pandemic, we didn't know how the virus was transmitted, and so most people were sort of confined to their homes, self confinement, and so now people are coming out and getting the care that they deferred during that time, and so our telehealth or virtual care has decreased a bit, but there's still a high percentage use. We're maybe I don't know what the percentages are right at this moment, but I know it's significantly decreased.
Let's turn, if we could, to social and cultural issues that we're all facing in healthcare in this country. Once again, the pandemic clearly highlighted issues of social equity, which you made reference to that as being much of the interaction with the system really is not in hospitals. Health equity is another key issue. And here in the MidAtlantic states region, and I guess with Kaiser Permanente generally, there's a partnership with Unite Us. Can you describe that for us, Ruth, and how is that working and fulfilling some of your objectives at Kaiser Permanente?
Well, Unite Us provides a technology platform that makes it easier for us to address some of the social needs that I spoke about. So if someone has hunger, eh, uh, sometimes we call it food insecurity. I call it hunger because when people are hungry, they're hungry, or maybe they don't know where their next meal is going to come from. So it's the food insecurity piece. So we try to Unite Us helps us to integrate our social care into our physical care so that we are able to help meet that need through community providers that can be accessed through the technology platform and help us in meeting the patient's needs. And that could be anything from food, it could be safety needs, it could be psychosocial needs, whatever our members need. And so Unitas has been a great partner with us to help us identify providers who can help meet that need. And it makes it easier for our providers so that they don't have to have a big Rolodex or something to call people and start dialing. Unitas puts all of that in a technology platform. The provider makes a referral, and someone takes it from there, and there's someone to make sure that the member or the patient gets what they need.
You're unique in a number of ways. First of all, you're the CEO who is a nurse, and you made the comment earlier that that has been not a common pathway, although perhaps somewhat better. You're also a Black person and a woman, so you've got a bunch of unique characteristics, Ruth. Our work shows about 20% of CEOs of health systems are women. Many fewer would be Black women. How have you found that in your career? Has that been something that you just constantly have to work around, or how has that been for you, Ruth?
I am very aware of the inequities uh, directed towards women and Black people in general and Black women. And so, what I have strived to do in my career is to really help mentor young women, young Black professionals who want to aspire to a career in healthcare leadership. And I can't reach all of them because I'm just one person. However, I do encourage people to go for their goals. And for me personally, I've been very fortunate. I think my nursing career and my nursing experience really helped me because as a nurse you are looking at problem solving skills, really, because in a hospital, really in any patient care situation, if a person comes to a healthcare provider, they have a problem usually. When if they're not living in the community, they're coming in for either a checkup and there may be a problem detected, or they're coming in with a problem. And so it's problem solving, identifying the problem and making sure that you address the right problem. In nursing, or whether it's in a broader leadership, sometimes identifying the wrong problem leads to the wrong, it always leads to the wrong solution usually. And so you have to spend the time making sure you understand the problem. And I think it's the same whether you're leading nurses or leading an organization. And so for me, as a Black woman, I'm comfortable in my own skin. I'm comfortable from where I came from. I mean, you heard me talk about my background earlier. So I am comfortable with a variety of people. In many cases, I am the only Black person, Black woman in a room. I hope that that won't be the case going forward. That's not something that I particularly celebrate because I want to see more people of color, Blacks, Asians, Hispanics, or Latinx. We need to have a broad tent because our country is a broad tent. And so we need to make room for people of all races and ethnic groups to be in leadership. And that's really important to me.
I'm sure there's a demand for you as a role model and a mentor, just as a leader, let alone with the uniqueness that we've spoken about. How do you handle that, Ruth? It feels like you could probably spend full time as a mentor if you had the time, but how do you manage that?
Well, in our organization, I really try to make sure that every person who wants one can have a mentor or a sponsor. I feel like sponsorship is really important. And so I can spread my impact in an organization because there are other people. I don't have to do it all. There are other people who can be mentors, that can be sponsors. And I encourage people to get a mentor and especially a sponsor. Um, I I try to. There are certain people that I talk to on a semi-regular basis when I can, but I can't do as much as I'd like to do because I just don't have the time. So I do a lot of speaking and a lot of presentations on how to advance in your career, how to really look at your career. As a phrase I like to use is, you're the CEO of your own career. So how do you manage the business of your career? How do you make sure that works for you? And so I try to give as much sort of group as advice as I can because I don't have a lot of time for individual mentoring, and I also try to sponsor people when I can. So those things are important.
Looking back on it, did you have a mentor or somebody who was particularly influential in your professional career?
Early on, I had a mentor who really gave me some tips on just doing certain things, networking with groups, joining professional organizations, and I learned, it's so interesting. In one of my early career positions, I learned the value of networking with search consultants who can be sponsors, silent sponsors. And when if you're busy, head is down, you get an inquiry from a search consultant. If you're busy, you're happy where you are, you have a tendency to just ignore it. I found early on that that's not the right thing to do. The right thing to do is to try to give that person some feedback on who might be someone that they could call, even if you're not interested. But that's a networking opportunity right there, and that was one of the things that one of my early mentors told me about. And I took it to heart, and I've done it ever since. So I didn't have a formal sponsor throughout my life. That person, we worked together for a few years, and then our careers took different paths. I still stayed in touch with that person and their family, but it became, a different type of relationship over time. I think that you're usually probably going to have two or three different sponsors if you're fortunate through your career, and then you then return the favor and become a sponsor or a mentor to others.
Ruth, this has been a terrific interview. We very much appreciate your time today. I have one last question, if I could, and that is that we have a number of people in our audience who are young, up and coming leaders. What advice would you have for them?
Be particularly mindful of your own career. Um, Set goals, have a plan. You can see by my comments, I didn't always have a plan, but I developed a plan, met it, then developed a different plan. But be open to opportunities that come about that aren't a part of your plan. I would say, so the plan, being attentive to your plan, and making sure you help other people and network. Networking isn't always for your benefit; it can be for someone else's benefit as well. And I would say work hard. You gotta deliver on what you say you're going to deliver. And that's really important because no one is going to take a chance on hiring you or promoting you if you're not reliable for delivering on what you need to deliver on in terms of your outcomes and accountability.
Great advice. Ruth, you're a true professional. Thanks so much for being with us.
Thank you for having me, Gary. This has been a lot of fun to talk. Thank you.